An alcohol use disorder is a cluster of cognitive, behavioral, and physiological processes that all work together in creating a problem with alcohol. All three of these need to be addressed in treatment. DSM-V diagnosis criteria for an alcohol use disorder. A problematic pattern of alcohol use, leading to clinically significant impairment or distress, as manifested by at least two of the following, occurring within a 12-month period. The presence of 2 to 3 symptoms equals a mild alcohol use disorder. The presence of 3 to 5 symptoms equals a moderate alcohol use disorder. The presence of 6 or more symptoms equals a severe alcohol use disorder. Here are the 11 possible symptoms. 1. Alcohol is taken in larger amounts or over a longer period than was intended. 2. There is a persistent desire to or unsuccessful efforts to cut down or control alcohol use. 3. A great deal of time is spent in activities necessary to obtain alcohol, use alcohol, or recover from its effects. 4. Craving or a strong desire or urge to use alcohol. 5. Recurrent alcohol use resulting in a failure to fulfill major role obligations at work, school, or home. 6. Continued alcohol use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of alcohol. 7. Important social, occupational, or recreational activities are given up or reduced because of alcohol use. 8. Recurrent alcohol use in situations in which it is physically hazardous. 9. Alcohol use is continued despite the knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by alcohol. 10. Tolerance, as defined by either of the following: a need for markedly increased amounts of alcohol to achieve intoxication or desired effect. A markedly diminished effect with continued use of the same amount of alcohol. 11. Withdrawal after cessation or reduction in alcohol, use that been heavy and prolonged, as manifested by either of the following: autonomic hyperactivity, sweating or pulse rate greater than 100 beats per minute, increased hand tremor, insomnia, nausea or vomiting, transient visual, tactile, or auditory hallucinations or illusions, psychomotor agitation, anxiety, generalized tonic-clonic seizure. Any combination of these 11 symptoms can constitute an alcohol use disorder, and severe acute withdrawal symptoms such as seizures and tremors are not required in order to be diagnosed with an alcohol use disorder.